The Italian government has donated about 3,002,400 doses of Johnson & Johnson's vaccines to the Nigerian government. The Executive Director of National Primary Healthcare Development Agency, Dr. Faisal Shuaibu, made this known in Abuja while receiving the vaccines from the Italian Ambassador Stephano. Dr. Shuaibu says that 13,588,718 persons have already been vaccinated, with another 23,012,700 others already on record to have taken the first dose of Oxford Astraneca Vaccines.
I thank you for joining us to receive, on behalf of the government and people of Nigeria, the 3,002,400 doses of the Johnson & Johnson vaccine donated by the government of Italy. You will recall that in February, the federal government of Nigeria, through the Federal Ministry of Health and the National Primary Healthcare Development Agency, formally rolled out the administration of the Johnson & Johnson vaccine across the country. I must say that this has rapidly improved our coverage. I want to appreciate the government of Italy for these donations, which is in line with the global call for equitable access to COVID-19 vaccines. It is also a reflection of the sincerity and commitment of the government of Italy and the European delegation to the global efforts in halting this pandemic for nations of the world to return to their normal ways of life. Let me assure you, Your Excellencies, distinguished ladies and gentlemen, that these vaccines, like all other vaccines we have in country, will be judiciously utilized. We have instituted accountability mechanisms for COVID-19 vaccination program to ensure efficient use of all available resources. Let me reiterate that we have adequate quantities of COVID-19 vaccines across all states for every eligible person in Nigeria, and to assure all Nigerians, our donors and partners, that we are committed to equitable and effective COVID-19 vaccination. I therefore urge all persons aged 18 years and above, including pregnant and breastfeeding mothers, to take advantage of the availability of these vaccines to get vaccinated. All COVID-19 vaccines in Nigeria are free, they are safe, they are effective, and they protect you and your families against COVID-19. As of today, the 11th day of April 2022, we have fully vaccinated 13,588,718 persons. This represents approximately 12.2% of our total eligible population. Meanwhile, 23,012,700 individuals have taken the first dose of the vaccine. This represents 18% of the total eligible population. We have also intensified our technical support to the states to ramp up the vaccination coverage in a bottoms-up approach. We are currently supporting the states to finalize their micro plans, which we believe will further strengthen accountability in the utilization and management of available resources and increase uptake based on locally acceptable methods and standards. To ensure we fully utilize the COVID-19 vaccination program in strengthening the primary healthcare system, we are also integrating with routine immunization as the entry point. This is the modality for our current approach to deliver COVID-19 vaccination, as clearly articulated in the Scales 2.0 strategy.
Nigeria is now having a significant impact on COVID-19 vaccination for its population. There's still a long, long way to go. I would encourage everybody to get vaccinated and to take their booster to ensure that while you are safe, everybody else can be safe as well. As the challenges ahead come about, it's donations of this kind that enables the MPHCDA and the SPHCDAs to be able to continue the program of vaccination and meet our ultimate goal of 70% of the eligible population to be vaccinated during the course of 2022. To do that, we need all hands on deck, and those states that have improved significantly over the past 3 months should continue to improve, and those states that have dropped off should reassess their micro plans to try and ensure vaccination.
Delivery of vaccines in Africa was expected to increase from 20 million doses to 150 million doses a month to meet the target of 70% fully vaccinated population by September this year. Coordination and cooperation among all stakeholders and actors remain essential to bridge these gaps. At the summit between the African Union and the European Union held in Brussels in February, the European Union reaffirmed its pledge to share vaccines with Africa and to work closely with our partners to develop local manufacturing capacity across the continent. In that regard, I wish to congratulate Nigeria on its selection, announced during the summit by WHO, as one of the 6 countries that will receive the technology needed to produce mRNA vaccines. By intervening at the summit in Brussels, His Excellency President Buhari called on fast-tracking the transfer of technology and intellectual property rights to make manufacturing of vaccines in Africa a reality. From our side, we remain committed to contribute to this goal and to support Nigeria to get access to vaccines, but also to become a hub for local production. And in the framework of our new multi-annual indicative program for the years 2021-2027, we will continue to support Nigeria in improving its health system and helping develop its vaccine manufacturing capacity. In that regard, we are in close contact with the Federal Ministry of Health to provide technical support, to contribute to mapping the ecosystem and identifying the existing capacity. And we are also in contact with the private sector to explore options for potential support.
We can look back at a success story of vaccinations which saved many of us in the whole world. But in Italy, believe me, we have 150,000 victims. We had today 150,000 victims because of people who didn't want to be vaccinated. So the donation that today is given from Italy in the framework of COVAX is a message of solidarity and mutual support. You know, Italy is the country in which most Nigerians in the European Union live. We have more than 130,000 Nigerians, all of them ambassadors of their country. So we cannot be without emotion when we talk about Nigeria, and this gift and this donation is a sign of our mutual solidarity, because there are no borders for pandemics. Everybody can be hit, and we should work together hand in hand to limit the outspread of this disease. So today we really remain very strongly committed, together with our European Union member states, our friends, to support Nigeria's needs in vaccinations, with the aim to help to expand global vaccine coverage. Providing these vaccines, which are single shot, will reduce logistical challenges and ensure fast achievement for your vaccination goals.